So before we finish with the GI assessment, I want to go back to assess. Carlos didn't describe any abdominal pain, but I also want to do two tests. One is the psoas sign, and the other one is a rebound tenderness. What I'm gonna be checking, it's for appendicitis. So for the rebound test, I just want to press down on his left lower quad, and I'm just gonna let it go. Let my hands go, and he should feel that rebound pain. So if the patient feels a rebound pain, that means there's possible appendicitis. The psoas test, I'm gonna have him laying on his left side with his right thigh bent, and then the pain should reflect on that side. So that means it could be positive for appendicitis. So I'm gonna push down, and you're gonna tell me if you feel any pain, okay? Perfect. And if you can, you lay on the left side, and then bend your knee, your thigh. And if the pain reflects on the right side, and the patient, do you have any pain? Perfect. So those are negatives. So now I want you to sit, and I'm gonna kind of move to the lower extremities. So what I want, I'm gonna kind of pull your pants just a little bit, so I can feel for your pulses. I want to check. I did check for femoral pulses, and they're even, equal, and this one too as well. I'm gonna check for popliteal pulses, dorsalis pedis. Pulses are even, and Carlos have his shoes, but we're gonna check for dorsalis. Posterior, these are even. They're bounding. They're +3. Perfect. And I'm assessing his skin. He doesn't have any scars. I'm gonna palpate for any possible lumps. And if you do upper thigh and kind of private areas, you want to assess the genitalia area for any kind of lymph nodes or any abnormal growth. So for this, I'm gonna do some movements. So I want you to extend your legs and flex them. Okay, so we're doing here, we're kind of doing plantar flexion and extension, and then if we do inside, we're inversion and eversion. Perfect. All right, so if you can lay down for me one more time. I'm sorry, I'm gonna check for your hips. So what I want to do, I'm gonna bend your knee and bring it up, and then we're gonna abduction, and we're gonna do abduction. Perfect. And then we do the same thing on the other leg. Just bring it up, and we're going back. Perfect. All right, perfect. So now I want you, if you can sit up again for me. So we're gonna do we're gonna check now for some rapid movement tests. So what I want you to do, I want you to, with one finger, you're gonna touch my finger and your nose, and I'm gonna be moving my finger, and you're gonna follow. So you're gonna do, this is my finger, you're gonna touch your nose and touch my finger, touch your nose and touch my finger, okay? Perfect. Perfect. So that means he does have good coordination. That's what we check there for. Squeeze my hands, okay? Don't let me push. Perfect. Don't let me pull. Perfect. All right, so that's good. I'm gonna do a little test for sensation also. Can you feel this? This? What can you feel?
Scratch.
Okay, perfect. All right, can you open your hands and close them? And let's do inversion and eversion, and fingers apart. Perfect. Okay, put your hands together, and don't let me push. Perfect. And don't let me pull. Perfect. Okay, so what I'm gonna check right now is I'm gonna check for reflex, and I'm gonna ask you if you can take one of your shoes off. I'm gonna check for Babinski reflex. In little kids, younger kids, Babinski reflex is positive. On adult, should not be positive unless the patient is having any neurological problems. We're gonna get to that one, but I'm gonna go ahead and relax your leg. Okay, small movement there, relax your legs. So I'm checking for deep tendon reflex. Okay, let's do it again, relax. Perfect. We're gonna do it on the other side. Perfect. So for the Babinski reflex, what I will do, and I'm gonna remove your sock for a minute. I'm going to all right, so small movement. So the toes, if it's when you do the Babinski reflex in an infant, the toes will curl up, which is abnormal, and then on normal adult toes, the toes will kind of curl down. It's not ticklish, that's why. So we're gonna do DTRs on his elbows too. All right, so kind of flex your elbow. And you can see the movement on his hand. Let's do it on the other side. Perfect. All right, and I think that we kind of went over the full assessment. We did talk about his skin all the way through. There's no masses, there's no lesions. And I think that we are done. Thank you.